Cephalosporins. Cephalosporins are considered as bactericidal. Indications or reasons why we administer this drug include skin, soft tissue, pulmonary, and GU infections. So microbes covered under this drug change depending on what generation we're talking about. So the level of gram-negative coverage increases with each successive generation. So we have the first generation, second generation, third generation, and fourth generation cephalosporins. The first generation primarily covers gram-positive, so they're susceptible to beta-lactamase enzymes. Now, the second generation has intermediate coverage, so it's for gram-positive and gram-negative, and there's more beta-lactamase resistant, so it has anaerobic coverage. Now, third and fourth generation primarily covers gram-negative organisms. It has an increased duration of action, especially the third generation, and it's also very good for cerebrospinal fluid penetration. So it can cross the blood-brain barrier. So this is actually a good drug to use when it comes to a patient who is having meningitis. Side effects include antabuse effect or disulfiram effect that happens during treatment and for approximately 3 days after the last dose. So this basically causes acute sensitivity to alcohol or ethanol. So we need to instruct our patients to not drink alcohol when they're on this medication and 3 days after their last dose. Signs and symptoms of antabuse effect include headaches, hypotension, severe flushing, palpitations, nausea, thirst, and chest pain. Cephalosporins are also associated to colitis or antibiotic-associated colitis. So after a patient is on this medication, they are at a risk of developing colitis from these antibiotics. Precautions and contraindications. Since cephalosporins are structurally and pharmacologically related to penicillins, we have to be careful when it comes to penicillin allergies. So if we are aware, if our patient tells us that they're allergic to penicillin, they are likely allergic to cephalosporin as well. Therefore, that's a contraindication. Again, some nursing actions include high alert if giving with penicillin allergies. Examples of drugs in this class. So from the first generation, we have cephalexin and cefazolin. Oral cephalexin, parenteral is cefazolin. Now, second generation includes cefaclor. So that's an oral medication. Third generation, we have a parenteral, which is ceftriaxone, also known as Rocephin. And fourth generation, parenteral, we have cefepime, also known as maxipime. So cefazolin is considered a first generation, therefore it covers mostly gram-positive. On the third generation, as mentioned earlier, we have ceftriaxone. So this medication is good for meningitis because it can penetrate the blood-brain barrier. As you may notice, all these cephalosporin antibiotics start with a C. Although they don't have the same suffix, they do have the same CEF on their names. So you have cephalexin, cefazolin, cefaclor, ceftriaxone, and cefepime.